sometimes breathlessness, and also palpitation, vomiting. These are the usual symptoms encountered during the procedure. Suppose patient develops syncope, how you manage? Until if it is an emergency, 6 months is okay, but generally we have to give duration for at least minimum 1 year. We have to be very careful while giving a local anesthesia, medicines like lignocaine.
Hi viewers, welcome to my channel Dental Treasures. So last episode we discussed medical emergencies and dental practice. So today we have with us Dr. Balamurugan, cardiologist and physician from Precautionary Heart and Dental Clinic, which is located in Chikkabalaswari. So welcome to the show, sir.
Hi doctor, it's my pleasure to join with you.
So as a dentist, there might be so many patients who visit us. So what precautions or what should be aware of it as from the cardiovascular patient point of view?
So there is various type of the medical emergency usually encountered during the dental procedure. We cannot concentrate only on the syncope or common problems, but we have to see the medical emergency like seizure and also stroke, hypoglycemia, hyperglycemia, as well as medical accelerated hypertension and hypotension. And other things is like myocardial infarction as well as the thyroid storm.
So as a dentist, there will be so many patients who visit our clinic day to day. What precautionary measures we have to take to avoid such medical issues?
So during this procedure, how we manage comfortably, that is more important rather than when getting panic. So it's better way before before the patients getting into medical emergency, we have to do proper workup, cardiac workup, general cardiac workup, and also lab investigations to be done, like simple tests like echo and TMT to be done to rule out any cardiovascular disease. We have to take proper clinical history, medical history, clinical history, as well as any surgical history. These are more informative, that gives more clue for the treating doctor, so they can work on comfortably when they're treating the patient. Like suppose patient develops syncope, how you manage? So how you cannot tell. So there will be a lot of confusion whether it is a syncope or due to myocardial infarction. So that has to be ruled out by we have to clinically assess the patient by proper investigating the patients when they are before the procedure starts.
So how do you differentiate between a syncope and a myocardial infarction?
It's very easy, based on the clinical assessment. Suppose patient developing syncope, usually they develop little bit of paleness of skin. Sometimes they have a profuse sweating, and also the altered sensorium, and again become unconscious. This is the one way we can differentiate from the syncope. In myocardial infarction, generally people with myocardial infarction, usually they complain of chest pain, sometimes breathlessness, and also palpitation, vomiting. These are the usual symptoms encountered during the procedure. So we have to be very careful in judging the patients with syncope as well as from myocardial infarction. So we can ask proper history, and also recording of vitals is more important than at that moment when the patient is conscious. Suppose in the diagnosis of syncope, only the fluctuations varies with the BP as well as the profuse sweating, but not like breathlessness, palpitation, or giddiness, or they have blurring of vision, high headache, some unusual symptom which commonly not encountered during their day-to-day life. Call for medical emergency, it is not that. Suppose if you have proved that patient is having is having myocardial infarction, you can give dual antiplatelet, supportive therapy, initial supportive therapy, dual antiplatelet. Suppose he is having severe pain, it is not that all patients will have pain. Suppose patient is having severe pain, chest pain, can give sorbitrate. Look out for the while. During the time, the BP should be normal when you are giving sorbitrate sublingually 5 mg. at least monitor BP before giving a medication. Then you can take a call whether to give a sorbitrate or not. To subside the pain, at least you can give morphine. At least he'll be free from the pain. He'll be comfortable. During the symptoms, when he's developing myocardial infarction, you can give a fluid that will. When the patient is having myocardial infarction, plus is in shock, you can either give IV fluids to at least to prevent hypovolemic shock. You can prevent that one. And during on table, patients also might be having hypoglycemia. Correct by giving dextrose. All these things that will help him and give comfort to the patient. And moreover, make an environment very peacefully, that its clothing should be not too tight, not too tight, and put the patient in the proper position. Either if he's in hypovolemic shock or syncope, put the patient in supine position, put him in Trendelenburg position, that is lifting of both legs at least 15 to 30 degree up, so that at least perfusion can happen for to the brain as well as for the heart. That will help him. And also, if you have an ambu ventilation, you can use the ambu ventilation for the respiratory purpose. So in that way, at least what are the basic things we have to be done, it has to be done in the clinic. Beyond our hand, we have to call up the emergency after stabilizing the patient. All these things, until it's emergency, don't wait. You have to be too fast rather than taking a very late step.
So is there any situation or condition where we have to strictly avoid the dental treatment?
Yes, we have to be avoided in certain conditions, like in cardiac conditions, like who had a recent MI, who underwent angioplasty with stent, is to be avoided, and bypass, and also people who underwent valvular replacement to be avoided, and people with hemophilia, the case to be looked into that, to be avoided.
So after 6 months, can we start these procedures?
Until if it is an emergency, 6 months is okay, but generally we have to give duration for at least minimum 1 year.
1 year.
So that at least without any hazards, and we can handle the patient comfortably.
So after dental procedure, we tend to give a lot of antibiotics, painkillers, NSAIDs. So is there any safe medication for cardiovascular patients?
As you mentioned that analgesic like Overon, and again antibiotic and other supportive medication for the dental procedure can be provided if patient's comorbidities to be considered. Suppose patient, they will be having medical problems like diabetes, again CKD, all these things. So you have to be very cautious in giving the analgesic. So instead of giving Overon, renal toxicity medicine, try to avoid that one. Proceed at least safer medications like tramadol can be given, and also paracetamol. These are all the little bit more safer for this type of risky people.
So we have dental procedures where we are supposed to give a lot of anesthesia, especially lignocaine. So is there any safety dosage or any alternative, or what precautionary measures we have to take when it comes to giving or administrating local anesthesias?
So we have to be very careful while giving a local anesthesia. Medicines like lignocaine, sometimes it might be coming up with adrenaline. So we have to be judge yourself which medicine to be given, which medicine should not be given when they have the communicated form. Some people with lignocaine, they may be allergic to the lignocaine. So for any patients comes to you, please have a test dose and look for any allergic reactions at the injected site. Then you can proceed for the procedure. Don't be in a hurry to get into the procedure after giving a local anesthesia. So this is the one thing. Some people will be allergic to lignocaine also. So we have to be the alternative medicine you can go for atticine.
Yes.
Atticine, that will be a little more safer rather than going for lignocaine. Is the thing. And people sometimes with allergic to adrenaline, they'll be having people with axillary hypertension, we should be very careful in giving lignocaine with adrenaline.
So
Again, this
plain.
causes vasoconstriction that will again triggers the BP.
So how did you manage syncope case during the dental procedure which occurred in your clinic?
And they called up for the emergency during the dental procedure. The patient who has developed syncope, I immediately checked for the vitals and look out for the clinical symptom. I put the patient in the proper position and checked for vitals, all these things. And also I checked we have checked the BP, which has shown that hypotension. I put the patient in the Trendelenburg position by lifting his leg 15 to 30 degree, so that perfusions can happen to the brain. And also we secured a IV cannula. I secured a IV cannula. Started with IV fluids because patients are having hypotension. Then when the patient had a syncope, we have checked for GRBS, which was very low, and started on dextrose drip. So in that way, after a few minutes, the patient becomes a little bit conscious and put back to semi supine position. And also once he become conscious, all these things, we just took a ECG to look out for any cardiac event has occurred or not. So naturally, we have done the ECG, which looks
So
normal.
you had to give CPR, so you gave CPR.
CPR. No, in some patients, in one cases I had given the CPR with the following all this protocol. I have given the brief CPR when the patient who had a complete loss of consciousness. Yeah. Then he has revived after giving IV fluids and dextrose. The patient is revived back to normal. Then again we took the ECG to look out for cardiac event. So in both patients, what I've seen to these two patients, revived with no cardiac events. So he treated and reassurance also given to him, and patient was comfortable and gone home comfortable.
So as a dentist, what emergency medicines should we keep in our clinic?
The medicines like atropine, epinephrines, and also should have antihistamine, and also steroid, diuretic, and sorbitrate, and dual antiplatelet, and IV cannulation is also important to keep in the clinic. IV fluids, in case of hypovolemic shock, you can start dextrose. These are the next is oxygen. If you have, and also you can keep ambiventilation. These are all the important medicines and other things to be kept in clinic.
So any message for our viewers?
First of all, you have to properly select the cases, which is emergency and non-emergency. Provided if it is a non-emergency, as a routine workup, you have to do proper vital checkup, lab investigations, and also counseling the patient in a proper way. That's proper educating the patient regarding the procedure, then proceed with the procedure. In case of emergency, like those are already had a cardiac events or other medical illness, we have to be very careful in handling. Like we have to do proper vital checkup, and again the schedule of your dental procedure, that is more important. You have to get it done during the daytime rather than the late time. This one, and also the patient should always accompany the bystander. That will help him, so that will be giving more confidence for the patient, so he can get the procedure done in a comfortable way.
And then
emergency number is also more important. In case of during dental procedure, if you develop any emergency, you can call up for the emergency services.
Thank you so much for sharing the in-depth knowledge about how to deal with this medical emergencies. And I'm sure my viewers will be extra thankful to you, and they'll definitely rewatch this video and take notes. Really, sir, thank you so much for this.
Thank you, doctor, for making me a part of your show. Thank you all. Thank you, all the dentists.